So you've been told you have GERD. You probably have a lot of questions. Maybe you don't even know what GERD means. There are lots of things you'll probably want to know. Like, what is GERD exactly? What can cause it? What are the symptoms you can expect? How will you know if you have it for sure? How can you treat it? And how can you prevent it or stop it from getting worse? This short video will go over all of these answers and more. Here are a few quick facts about GERD. GERD is among the top 10 reasons why people seek medical care. Because GERD is related to obesity, and the obesity epidemic in this country has been skyrocketing, GERD has also been increasing. The range of GERD in the United States ranges from 18.1% to 27.8% depending on the study. This is a very large percent of people in this country suffering from GERD symptoms. For patients who have GERD, costs can be substantial. These costs can include laboratory testing, more invasive testing, medications, time off of work for doctor's appointments or for symptoms, and multiple physician or specialist visits depending on the severity of their condition. So what exactly is GERD? The acronym GERD, G-E-R-D, stands for gastroesophageal reflux disease. In medical terms, the term gastro means stomach. For people who have GERD, the acid in their stomach leaks up into the bottom half of the esophagus through an opening that has become weaker over time. This opening is called the lower esophageal sphincter, or LES for short. Normally, your LES would prevent the stomach contents, such as acid and bile, from refluxing up into your esophagus. When you have GERD, your LES becomes weaker and does not hold your stomach contents down as it should. These stomach contents can leak up and cause irritation to your esophagus. Over time, these fluids can irritate and cause changes to the lining of your esophagus. Your esophagus does not have the same protective mucus covering that the stomach does. It is not meant to be in contact with acid and bile. The irritation to the esophagus causes it to become inflamed, which then causes your GERD symptoms. So what kind of symptoms can you expect? Heartburn is the most commonly recognized. Other symptoms that may not be recognized as signs of GERD include sore throat, a sour taste in your mouth, hoarseness, regurgitation of food or acid, dry cough, or difficulty swallowing. So what exactly causes this weakening of your sphincter? Weakening can be influenced by many things, including being overweight, eating irritating foods, slouching positions, or putting pressure on the stomach from tight clothes or from overeating. There are many treatment options for GERD, but if you decide not to treat it, serious side effects can occur. These can include bleeding, ulcers which cause bleeding, throat narrowing due to scar tissue buildup, or a precancerous state called Barrett's esophagus. So how will you know for sure if you have GERD? The best way is to start out with an evaluation by your doctor. Your doctor will review your symptoms and determine if he thinks further testing is needed. One test that may be ordered is a blood test to check for a certain bacteria that can be causing symptoms similar to GERD. If you are found to have this bacteria, called H. pylori, you will be given a different treatment plan than if you just have GERD. For more serious cases, additional testing may be required. This testing is more expensive and more invasive. One test, called endoscopy, requires that you be sedated so that a probe can be put down your throat. This probe will allow the doctor to take a look at your esophagus, determine if there are any changes happening, how your sphincter is reacting, and also take some samples if needed to test for precancerous cells. Another test that can be performed is a pH test. A small probe will be inserted into your stomach and left in for a full day. This will measure your acid levels, both at rest, during eating, and while you're sleeping. The latest research recommendation on testing indicates that it is most cost-effective to try empiric or trial treatment therapy before ordering costly tests. If you respond well to the treatment, there is no need to go for further costly or invasive testing. So now that you've been diagnosed, you'll want to know what best to do to avoid symptoms, treat your current symptoms, and prevent them from returning. In the case of GERD, treatment and prevention options are very similar. One lifestyle change to make will be to avoid large meals. Eating smaller meals throughout the day decreases pressure on the stomach and helps with gastric or stomach emptying so that you don't have a lot of acid in at one time that can splash up into your esophagus. You'll also want to avoid eating 3 hours before laying down. This will give the stomach time to empty before gravity takes hold while you're laying horizontally and causes an acid reflux. Avoiding tight-fitting clothes around the waist area can help reduce pressure on the stomach and keep the acid where it belongs. Maintaining good posture is also important in treating and preventing GERD symptoms. You want to avoid slouching, especially while sitting, because this puts extra pressure on the stomach and can lead to reflux. If you're continuing to have symptoms while you're sleeping, you can elevate the head of your bed using blocks or a wedge. About 30 degrees helps gravity to keep the stomach acid moving downwards in the proper direction. One of the most important lifestyle changes you can make to avoid or treat GERD is to avoid irritating foods. These foods include caffeine, alcohol, chocolate, citrus fruits, tomato products, spicy foods, and fatty foods. These trigger foods can be slightly different for everyone. It may be helpful to keep a food diary that links to your symptoms so that you can learn what to avoid in the future. If these lifestyle treatments are not enough to stop your symptoms, there are medication options available. One option you may try are over-the-counter antacids such as Tums, Maalox, or Mylanta. These medications work immediately to neutralize acid already in the stomach. Another class of over-the-counter drugs are called H2 blockers. These include Pepcid or Zantac. These must be taken before a meal, as they prevent your stomach from producing too much acid. A stronger category of drugs that prevent your stomach from producing too much acid include proton pump inhibitors. These medications, such as Prevacid, Protonix, or Nexium, work best when taken first thing in the morning for several days in a row. If none of these over-the-counter options work for you, there are stronger drugs, motility agents such as Reglan and related drugs, that can be prescribed by a doctor. These drugs will actually help the flow of food through your esophageal tract, but they can have more serious side effects and have higher costs. Your doctor will perform a risk-benefit evaluation and decide whether you'll be a candidate for one of these prescription drugs. If the lifestyle modifications and medication options are not working for you, last case scenario, you can have surgical options. In a procedure called fundoplication, a surgeon will wrap part of your stomach around your esophagus to tighten up the passageway. This option carries increased costs and risks, and may not always be successful, so it is best to start with the modifications and the medication therapy before going on to surgical options. One of the most important things you can do to treat or prevent your GERD symptoms is to maintain a healthy weight. Studies show that losing even a small amount of weight, 10 to 15 pounds, can take pressure off of the stomach and improve symptoms of GERD. If you follow these treatment options, lifestyle changes, take your medications as prescribed, and maintain a healthy weight, your GERD is very treatable. Using these treatment options, most people will report an improvement in their symptoms and will not require surgery. Here's a list of references used to put together the information in this video. If you have further questions or would like more information about your condition, feel free to contact your healthcare provider.